Good evening, Professor, Doctor, and colleagues. My name is Agus Santosa. I am lecturer at Faculty of Medicine, Warmadewa University. I would like to present my abstract title, Increased Prestin Nicotinamide Adenine Dinucleotide Phosphate or Nadph Oxidase-2, low-density lipoprotein, and decreased high-density lipoprotein as risk factors for sensorineural hearing disorders in patients with type 2 diabetes mellitus at Professor Dr. Igus Dingurah Gedingurah Denpasar. Abstract. Uncontrolled type 2 diabetes mellitus or T2DM causes both acute and chronic complications, including microangiopathy complication, especially sensorineural hearing loss. The condition of sensorineural hearing loss in T2DM is suspected due to a decrease in the quality of outer hair cell and complication of microangiopathy in the cochlea and atherosclerosis mediated by Prestin, NOx2, LDL-C, and HDL-C. However, until now, there have been no studies that have specially assessed this biomarker as risk factor for sensorineural hearing loss in T2DM patients. This study aims to prove high Prestin, high NOx2, high LDL-C, and low HDL-C as risk factor for sensorineural hearing loss in T2DM patients. This research method uses a case control design in T2DM patients aged over 18 until 60 years, which has been carried out at Diabetes Center Polyclinic at Professor Dr. Igus Dingurah Gedingurah Denpasar in the period January 2023 to May 2023. The sample from the study were cases of T2DM patients with sensorineural hearing loss, and control were T2DM patients without sensorineural hearing loss. The independent variables are the Prestins, NOx2, LDL-C, and HDL-C, and the dependent variable is sensorineural hearing loss. Primary data were obtained from patients during visit and examination at the polyclinic. The data obtained was subjected to univariate, bivariate, and multivariate analysis using SPSS version 25 for Windows. A total of 36 responses were included in this study, of which 18 were cases and 18 were control. In cases and controls, the average age was 51.5 years and dominated by men, 55.6%. Based on the risk analysis, it was found that there was a significant effect on high Prestin level, P equivalent 0.049, AOR 4.086, and 95% CI 1.007 until 16.579. High NOx2 P equal 0.020, AOR 6.250, 95% CI 1.327 until 1029.432, LDL high C P equal 0.036, AOR 6.400, 95% CI 1.124 until 36.437, and low HDL-C P equal 0.010 and AOR 7.856 and 95% CI 1.651 until 37.403, and hypertension on the incidence of sensorineural deafness in T2DM patient. Conclusion: This study proved high Prestin, high NOx2, high LDL-C, and low LDL-C as risk factor for sensorineural hearing loss in T2DM patient. Keywords: HDL and LDL cholesterol, Prestin, Nadph Oxidase-2, sensorineural hearing loss, type 2 diabetes mellitus. Thank you.